Yes, sir.
Does the student loan reform affect existing loans or only new loans?
Good question. For reasons I can't fully explain to you, a reform of the student loan system was included in the legislation. The student loan reform will do this. It basically takes the banks out of the actual lending of money. They will continue to service the loans. So the answer to your question is that people who have existing loans will largely see absolutely no, in fact not largely, they will see absolutely no change to their loans. But just to take a step back here, student loans was a great deal for a lot of banks. Why? Because a bank would extend a loan to a student to go off to college, and the government would guarantee 94% of that loan. We were taking the risk. We taxpayers, we as the government, they were making the money on it. So by saying that the government will take the risk and extend the money, but that the banks will service them, because look, banks are better at servicing loans than the government is, we will save $60 billion over 10 years. To let you know how that will affect the state of Connecticut, over 10 years, that money is getting used for Pell Grants, which are grants for kids to go to college who are lower income kids. $230 million of that money will find its way into Connecticut in terms of more Pell Grants. But no, people with existing loans, and in fact in the future students will not see any real change in the process because they will still deal with the banks, but they will use the government's money and not extend their own.
Except for the 10% cap. You said the student can't pay more than 10% of his annual income to pay off the loan. Right.
Okay.
That continue?
The 10% cap.
How money they make when they
Yeah.
get out.
Hey, Peter, the answer is I don't know the answer to your question, so I'm going to find the answer to your question. Does the 10% income cap on student loans, does that continue on subsequent to this reform? Well, please let me make sure I get a name so I can return. Yes, ma'am.
You mentioned earlier that the state of Connecticut, and other states, of course, will help to fund new doctors, new healthcare workers, to take care of the needs of the additional people who will be covered. You, as a lady who was just at the microphone mentioned, she represented many new people who will be covered. How is the state of Connecticut, that is broke, that is deeply in debt, and all of us are deeply in debt for the state of Connecticut, how are they going to pay for these things? How are they going to pay, and of course it's every state, for the millions of people who will be dumped into the Medicaid system? How are they going to pay?
To be clear, I either misspoke or you misheard me. The additional doctors, the additional nurses, the programs that are in place to create more primary care caregivers, those are funded not by the states but by the federal government. The state responsibility, which is very serious, your question is right, it's just not right about the doctors, is the Medicaid share. States, as you know, pay a portion of the Medicaid, and the other dollars are federal dollars. And this is a huge problem. The state of Connecticut has a very, very severe fiscal situation. We tried in the Recovery and Reinvestment Act to send money to the states to help them with that. That ultimately meant towns had to fire fewer teachers and teachers and policemen and whatnot. But the Medicaid cost will still remain quite serious for our states. This does not get fixed by the health care reform, and this will be an ongoing fiscal discussion at the state and federal level.
But it gets magnified by the health care reform because it puts millions and millions and millions of people into the system.
But remember what we're talking about when we're talking about 31 million new people. We're talking about a hugely diverse group of people. We're talking about an executive who lost his job but will get a new job. We are talking about, you know who we're talking about in many instances? We're talking about young people who will be required now to get health insurance. And I want to come back and address that. But remember, we have a population of people here who may be advantageous to the system because some of them are young. Now let's talk about the individual mandate, because I know it's been the subject of an awful lot of concern. All of us feel, first of all, what's really happening. What's really happening is that individuals who choose not to purchase health insurance will pay a tax penalty ranging from $700 to a maximum of a couple of percentages of points of their income. That sits uncomfortably with a lot of people. There's some question as to whether it's constitutional or not. You know, the courts will decide that. I'm not a constitutional lawyer. But I'd ask you to think about it this way, which, by the way, is exactly the way Mitt Romney asked Massachusetts to think about it. Why should a 22-year-old who is healthy have health insurance? I've got a libertarian streak in me. I don't like the notion that the government compels him or her to do so, except for one thing, which is that 22-year-olds get hit by cars. 22-year-olds get diagnosed with terrible diseases. And when that happens, if they don't have insurance, it is all of us who are paying for that 22-year-old's care. Economists call this a free rider problem, and this is exactly the way Mitt Romney described it. So 22-year-olds may feel put out that they are buying insurance and think that they're immortal and they don't need it. But 22-year-olds from time to time need massive interventions and massive numbers of dollars to keep them alive, and they either contribute or they don't. And if they don't, we're going to pay more.
Pre-existing condition.
What would be a pre-existing condition?
The fact that he was diagnosed with a serious illness.
Not anymore. As a result of this reform,
So why buy insurance until you're diagnosed?
because otherwise you're going to, first of all, it's a smart thing to do, because I don't think if you get diagnosed with leukemia, you really want to have the emergency room be your first experience with the healthcare system.
I'm going right down to insurance companies now on insurance policy. It's pre-existing, they cannot deny me insurance.
And the other reason you wouldn't do it is because you'll be subject to tax penalties if you don't buy insurance. Now, you may choose to take those tax penalties, you may choose that, but if you choose to take those tax penalties, you're doing what I think we all agree makes some sense, given that you might end up in the emergency room, which is you're contributing to the system through your tax penalties. Yes, ma'am.
I think I'd like to go to the student lending topic, although I can talk on many of them. The concept that my federal government agreed to back the loans of people who chose to go to school and do so on a loan doesn't sit well with me. And recognizing that that wasn't working out for their part of the bargain, for the federal part of the bargain, I would have very much preferred the federal government saying, effectively, we will no longer support that. We will no longer back them. These folks need to go and get someone else to co-sign their loan for them, not to put them in the general pool of every American taxpayer. So on that level, I have a problem with it. But what I also have a problem with is that it basically takes away the ability for the private sector to be in that business. They've created a monopoly that only dollars through the government can be used to borrow against your education. So how constitutional is that for my government to create a monopoly that doesn't let me go into the banking business in this particular area? I don't understand that.
Okay. That's a good question. And here's what I would say to you. The question, I'm sorry, the question was involved, but the question was, did the government sort of create a monopoly in student loans such that the private bank can't now go in and on a private basis provide student loans to students? And it's a fair question. However, speaking as a former banker, I will tell you that there is no way that banks would provide student loans to students at anywhere near the interest rates that they currently do without that government.
It doesn't matter to me. Then let the business figure that out. I don't really like my government telling any industry that now you're out of that business. Let the private industry put it out there, and if people
A bank can
want
make a loan for any reason they want, and the person who gets that loan can use it for any reason, so you don't call it a student loan. The banks have not, if they want to make a loan to somebody and that person wants to use it, they're not saying you can't make a loan to that person. They're saying you're not going to get the special benefits that we gave.
Here, let me.
That's all. They're not going to get that.
I want to get back to healthcare. Let's distill this debate down to what it really is. The government has subsidized education through the previous structure of student loans and will continue to subsidize it. Now, we were subsidizing it in a way.
You know what, Jim? That's a continuation that I take issue with.
Can I
Maybe that's where it is. That continuation is where I take issue.
Okay.
They recognize